Good afternoon, everyone. I am Sri Weerasakara and I am glad to present the findings of our preliminary study titled Serum vitamin D, adiponectin and insulin resistance in being healthy Sri Lankan adults. Insulin resistance is the main cause of metabolic-driven non-communicable diseases. Insulin resistance is a state in which a given concentration of insulin produces a less than expected biological effect. Many factors are contribute to insulin resistance: lifestyle factors, individuals' habits, and genetic predisposition. However, recent studies have shown that the significant role of vitamin D deficiency and low adiponectin level in developing insulin resistance. Vitamin D improve insulin sensitivity by enhancing insulin secretion, protecting beta cells from apoptosis, and reducing oxidative stress. Adiponectin, which is an adipokine, in other words a hormone primarily secreted by adipose tissue, enhance the insulin sensitivity by increasing fat metabolism and regulating glucose tolerance. Therefore, vitamin E deficiency and low adiponectin level has a direct link with insulin resistance. In this modern era, we observe rapid rise in metabolic-driven non-communicable diseases and increasing number of premature deaths due to these MCDs. The main huge burden is seen among the South Asian region. South Asians have higher body fat percentage even at a lower BMI. They have great abdominal and ectopic fat despite their lean appearance. Therefore, South Asians have a more pronounced insulin resistance even at a relatively lower BMI compared to Caucasians. Therefore, the primary objective of the study was to assess the insulin resistance, vitamin D, adiponectin and lipid profile in a cohort of apparently healthy lean adults in Anuradhapura. Moving on to the methodology, we conducted this preliminary cross-sectional study in Weerasakara district with 22 participants. After obtaining informed consent from all the participants who were aged between 30 to 59, all with normal BMI, waist circumference, normal fasting plasma glucose levels and not previously diagnosed with non-communicable diseases. Following that, 10-hour fasting venous blood sample was collected from all the participants. These biochemical parameters were analyzed using standard laboratory protocols. We calculated the insulin resistance using HOMA-IR and TYG index. For TYG index, we use both Indian and Korean cutoff values. Further details regarding these indices will be discussed in the results section. Moving on to the results, out of the 22 participants, 10 were male and 12 were female. The mean age of the participants was 42 years. There was no significant difference between BMI and fasting plasma glucose levels. The lipid profile data of these apparently healthy individuals is shown in this bar chart. Despite having normal BMI and waist circumference, 77% of participants had elevated LDL cholesterol level, while 50% of participants had elevated total cholesterol levels. Most importantly, all the females and 90% of the male had at least one abnormal parameter in their lipid profile. HOMA-IR is the most widely used index to calculate insulin resistance. However, recent data revealed that TYG index is better than HOMA-IR to calculate insulin resistance among South Asians, as HOMA-IR index often underestimates the insulin resistance case among South Asians. Therefore, we use both HOMA-IR and TYG, Korean and Indian cutoff values to calculate insulin resistance. According to Indian TYG index, 100% of participants had insulin resistance and 59% according to TYG Korean cutoff and 45% according to HOMA-IR. When considering all three indices together, 82%, that means 18 out of 22 participants had insulin resistance at least by 2 indices. 86% of the participants had vitamin insufficient or deficient vitamin D levels. Most importantly, all the females had vitamin D deficiency or insufficiency. Despite having normal BMI and waist circumference, 23% of lean individuals had low adiponectin levels. Among the participants with vitamin D insufficient or deficient, 84% of them had insulin resistance. Among the participants with low adiponectin levels, 80% of them had insulin resistance. When considering all three parameters together, among 18 individuals who had insulin resistance, all except 2 had at least dearranged vitamin D and or low adiponectin levels. Through the results of this preliminary study, it can conclude that 100% of participants had at least one dearranged metabolic parameter. 20 out of 22 participants had at more than one dearranged metabolic parameter. So, we can conclude that the considerably high prevalence of hidden metabolic-driven non-communicable disease risk factors among these apparently healthy lean adults. We recommend further studies with larger population to validate these findings and comprehensive community-based screening programs to uncover the hidden burden of non-communicable diseases and to initiate appropriate preventive strategies. Despite being lean and apparently healthy, we, the South Asians, are not out of the NCD risk. So, lean individuals also have to be included in community-based screening programs. These are our references, and thank you.
Great. Thank you so much for that very nice